Welcome, everyone. Good afternoon. It's just straight up noon. Let's just wait just a minute or two so we can get everybody from the waiting room in. Well, I think we'll just go ahead and get started. I'm not seeing anybody else in the waiting room. Happy Friday. I'm Brooke Lovelace, Executive Director of the Iowa Developmental Disabilities Council. Thanks for everyone for being here with us today. We might have a few more people that will join us. It's such a beautiful day out. Maybe people are out playing hooky because we had over 50 people sign up for today. But session is over, and so Amy's going to give us the highlights and lowlights of that, and then we're going to talk a little bit about the advocacy that you guys can do over the summer. And Amy, I'm not sure, she's not able to turn on her camera today, so you will not see Amy. You'll just be able to hear her lovely voice. So with that, Amy, why don't you kick us off?
Thanks, Brooke. Can you hear me okay? Just double checking.
Yep.
Okay. Yeah, sorry, I'm driving to Kansas City, so I'm soccer mom this weekend. So I apologize for not having the camera on, but that would probably be a violation of the new law on distracted driving. So I probably should not do that. Yes, session ended yesterday at 6:30 a.m. After over 20 hours of being in session. So it was an overnight finish. I think the last caucus started at 3:30 in the morning. So we have not been able to get the bill tracker all caught up yet, but I hope to do that this weekend so that by the start of next week, you'll have everything up to date and accurate in there. One of the challenges we had with the session ending like it did was they passed something like 75 bills in that last 3 days. And the most of them had massive amendments on them, especially the budgets. And we literally didn't see the budget final deals until the night session ended. So that's kind of been challenging in catching up. But I wanted to give you some of the highlights of what happened. I will say this session, we saw the most bills ever introduced in the House by a long shot, like 400 or 500 more than the highest number ever before. We had 3 special elections during the 4-month session. So there was a lot of changes going on in the House with those 3 elections. The newest legislator, Representative Angel Ramirez, who took over for Sammy Sheets in the Cedar Rapids area, she was sworn in, I think, the day before we ended. So didn't really participate much this session, but will be doing so next year. Of course, the governor announced she wasn't going to seek re-election, and we had the House Minority Leader announced she's running for Congress, so they selected a new minority leader. There was just a lot of things that happened this session, and one of the things that didn't happen that you might have heard a lot about was property tax reform. So they weren't able to get a deal on lowering people's taxes that they pay on that are based on the value of your home. But I would expect to see that next year for sure. Going to the slide that says budget highlights, I wanted to kind of go over what was in the final package of the budget. So we had pretty much what the governor had asked for, a $252.7 million increase for Medicaid. Most of that is for just just growth in the program with people, or the number of services, or the cost of services. That's just kind of to keep everything the same. But there were a few increases. One was the biggest one was a $20 million increase for nursing homes. But there was a small increase, $3 million increase for home and community-based services, intermittent services. To fully increase those the way that providers wanted, and that would be day habilitation, employment services, respite, and intermittent SCL, supported community living. To do that, they really needed $8.5 million to make the increases in those programs the way they were needed. So I don't really know how they're going to apply that $3 million, if they'll just apply it to employment and SCL, or if they'll pick something from it. I think the SCL was going to cost about $3 million itself. So, but I've heard from a lot of providers that if employment services rates aren't increased, they might start cutting back on those, which would be very concerning, especially given that the Medicaid work requirement bill did pass and is moving forward. So you want to make sure you have all those employment supports that are going to be needed for people. There was a $2 million increase for dentist rates. They haven't received an increase for, I think, 30 years or 20 some years. Representative Turek was able to get a $100,000 increase in the rates for prosthetics. And they were also increased personal needs allowances for people that live in ICFs or nursing facilities or skills facilities. So their monthly personal needs allowance would go from $50 a month to $55. They had originally proposed $65, but lowered that to $55. I don't think that's been increased in like 30 years either. So there was also included a ban on sex reassignment surgery paid by Medicaid and hormone replacement therapy. But they did take out something that would have banned the mental health therapy for gender dysphoria. That was really concerning to a lot of people, that you would be taking mental health therapy away from someone who might need it. So that was taken out. Kind of moving over to the education budget, they continue to cut AEAs and school districts now because they're sharing those funds by $32.5 million. That's the same cut they had last year. They were able to get $14 million to continue the paraeducator or educational support professional salary increases. I'm not sure that the language was exactly what people who are advocating for special education wanted, because some schools had used that for other educational support professionals, not just paraeducators, so they didn't get the full salary increase to $15 an hour that they were promised. So they did change the language some. I'm not sure it's enough to make sure that the schools use it that way. We'll have to continue to monitor that. There was a big fight up until the very end on special education funding. The department had not spent its entire $10 million on special education services last year. That doesn't mean there wasn't a need, but they only wanted to give special education $5 million this year, but they did end up finding the full $10 million. The problem is they use $5 million in the budget and then $5 million from sports wagering. So like when people bet on sports games, football game or something, some of those monies would go to pay for that. It could give the governor an opportunity to veto one of those, because she can just veto out specific parts of budget bills instead of the whole. She doesn't have to veto the whole bill. So I think there's some worry by having a $5 million appropriation in one bill and a $5 million in another bill the governor could veto one of those and you end up with just 5 million. So that's something we're going to be needing to watch. Also, the Senate had cut the Iowa Able program, the savings program, cut the $200,000 out of their budget for the administration of the program, and in the end, the House got it back in. So we were able to continue funding Iowa Able. Otherwise, we would have joined, 3 or 4 other states that don't have a program. So fortunately, that was funded. I think there will be an ongoing discussion about how to make that a self-sustaining program so it doesn't need to have admin funds, but that's something we'll be watching in the future. Couple other things that I know people watch, vocational rehabilitation, entrepreneurs with disabilities. At one time, there was an increase in the budget, but that did not make it into the final deal. So it's just same level of funding as last year or the current year. They continue to fund the Farmers with Disabilities program, Best Buddies, and the Lead K program, which was the one that was passed a couple years ago to provide language equality for children who are hard of hearing or deaf, and that kind of develops materials for families so that they can make sure their kiddos are staying on track and make sure they're staying on track during school as well. So that continued to be funded. Going to the next slide. Oops. I don't know where my slide went. Hold on a minute. I dropped it. You probably hear my car thing. Sorry about that. So there's a lot of bills that are headed to the governor. I've listed a few of those that are have passed. One passed early on, the autism spectrum disorder coverage for private insurance. So taking off the age and annual caps. There's one that provides stronger penalties for people that are lying about having a service animal. And then House File 835, seizure safe schools. So schools will begin making sure that they have trained staff on medication administration and training everyone in the school, including students, on identifying and learning about seizure first aid. So that bill has passed. None of these, only one of these, I believe, have been signed that I have listed. There's a new definition of school bullying, which has some school administrators concerned. They felt the current bullying language guidance that was in the law was very clear on what was bullying. They've changed that so you no longer have to have the bullying target people because of their gender or their disability or their race or some other distinguishing feature. Now they're concerned that maybe the guidance isn't going to be as clear, and that people might not, schools might not intervene in the bullying. There was a lot of people talking about, oh, kids are just kids. Kids will be kids. And that was particularly concerning, I know, to a lot of parents of kids with disabilities, that they want to make sure that the schools are on top of that and making sure that people are not being bullied because of their physical characteristics or other things. There also was a bill that you might not think, why are we covering disclosure of lead service lines? So you've heard a lot about lead being in old pipes in like the city of Flint and a lot of Michigan you've heard about, and that lead does cause intellectual disabilities when exposed to children, and so it is a prevention measure to make sure people know that they have lead coming into their homes so that they can do something about it, and that they're aware of it. So I know if you look at a map of the city of Des Moines, I think like almost all of the city of Des Moines has lead pipes. A lot of older towns do. There's also a bill called Mason's Law, a child that had serious chronic illnesses and was terminal, and there was no place other than a hospital for him to go. And the family really felt like there should be something like palliative care, where you can go in a home-like environment and be with your family during those final days. And so they created, Iowa will be the first state to create this new they call it pediatric palliative care centers, but they're basically like a hospice with a lot more medical components to it. And I think they're from Council Bluffs, the family that had pushed for this. Accessory dwelling units, those are the tiny houses or expansions of a house that basically says a city and local government and cannot tell you can't build one on your property. A lot of people are looking at this as an opportunity to have aging parents or an adult child with a disability or a caregiver living independently in a separate home, but being close to the caregivers or to the family that might be providing that care. And so that bill was signed into law. That was a push by AARP, but I know they worked with the DD Council early on to listen to any concerns and thoughts that they had on that. The big one, Senate File 615, did finally pass. It's the work reporting requirements for the people that have the Iowa Health and Wellness Plan. So those are for people who are not disabled, age 19 to 64, who are on that plan and meet the income guidelines. It's not children, it's not people on regular Medicaid, would be required to work 80 hours. The governor has already, her public comment period closed yesterday afternoon, and they had 100 hours a month in their work requirement. I am anticipating they're going to have to change that to 80 hours now that the bill has passed. I want to say that while it says if you have a disability, you would be exempt, but it's only if you have a disability you meet the definition, have disability through Social Security. So we know that there are some people that don't have that designation. Caregivers might be under this. So we're going to have to watch the implementation of this. And we know that the federal government's considering it too. So even if we hadn't passed it, it might have happened anyway on the federal level. But I was definitely going to try to do that. I think the saddest part of having that bill passed was that they took out the one thing we really liked in it, which was a requirement that the Department of Health and Human Services look at other states' Medicaid for Employed Persons with Disabilities programs, the MEPD program, and work without worry, look at how those work and back with a report on how we do that in Iowa. So we really found that pushed the worry and would get us a little bit further next year if the department had done some work and research on that. So that was disappointing. Representative Turek tried like 3 times to add it to other bills, but he was not successful in doing that. So disappointing that got taken out. Also disappointing that with the passage of that bill, it says that if the federal government ever decides to not allow work requirements, like if a change of administration, change of Congress, and they say, nope, we're not going to do work requirements anymore, that means our entire health and wellness plan goes away. So all of the health insurance for those 180,000 Iowans would go away if the federal government told us no. So that's kind of also a really bad part of that bill. And then Senate Joint Resolution, that's what the SJR is, 9, is a bill that protects minors and people with disabilities, intellectual disabilities in particular, who are have to testify in court as a witness, and that can be very challenging for people, particularly children, to face the person that might have hurt them. This is a constant, so it passed this year, and it will have to pass in either 2027 or 2028. It has to pass 2 different 2-year cycles of the legislature. They call a 2-year cycle a General Assembly. So it has to pass 2 different General Assemblies. So it passed this year, it has to pass again in 27 or 28, and then it'll go on the ballot for people to vote on it, either 27 or 28. So it's a long process to make that change. Going to the next slide, some of the things that didn't make it, and you can see the whole list here. We were disappointed that we couldn't get funding for the comprehensive transition programs like REACH, Next, I think it's Educate up in Mason City. These are programs for college-age kids with disabilities. They're not kids anymore, right? I think everybody that's under 30 is a kid, but that the bills didn't pass, and then we had heard, well, it's because it needs an appropriation, so we'll wait for the budgets. Well, it didn't make it into the budget either. So both of those bills, all of these bills will still be alive next year, so we can keep pushing for them next year. We knew House File 408 wasn't going to pass because it would have cost a lot of money, but it cleared all of the waiver waiting lists. Great bill. Then you see a bunch in a row, 425, 426, 427. Those are all Representative Turek's bills to try to get rid of prior authorizations and extra doctors' visits and provide continuous coverage for various supports, complex rehab technology and wheelchairs, durable medical equipment, the power standing equipment that attaches to a power wheelchair. All of those he had kind of brought up, and they did have subcommittees on them. It's just they didn't make it very far this year. There was also an interesting one, House File 483, that would have created a state architect and had their duty be to go through all of the public buildings to ensure that they're accessible and to the public and to all of the public, including people with disabilities. So we've kind of talked about that off and on about, especially after last year when they passed the parks accessibility bill. Another one we were really disappointed in and really thought it was in the bill until the last day of session was adding applied behavior analysis, which is what ABA is, to the Children's Health Insurance Program called Hawkeye. It's unfortunate because now ABA is covered by Medicaid and it's covered by private insurance from a bill that passed earlier in the session. So it basically, as you move from one plan to another, if you're on regular Medicaid, you start earning more money. Maybe you go on, your kids go on Hawkeye, that you can't quite afford private insurance yet. You'll lose the ABA services. So it creates kind of a canyon between Medicaid and private insurance where Hawkeye is, that you don't have that coverage. So that's disappointing, particularly because we're spending about $750,000 a year on 10 families to access these services, and all but one of those qualify for Hawkeye. So they could have taken that $750,000, used it to pay for this, and served way more kids, drew down federal match, so it would have brought in more money, to pay for services for more kids using the same amount of dollars. So I don't know why they didn't do it, honestly. I don't think the senators understood it, is what I kind of gathered in my post-session conversations. But I would say that's going to be a big push next year. There was a bill that banned sub-minimum wage for persons with disabilities. So those certificates that businesses can get to pay less than minimum wage, that bill did not make it move forward. You can see some of the other ones on there. Of course, work without worry. It was a big one as well. But those, I would consider those ripe for next year. So when you look at the inactive list on our bill tracker, so anything that didn't make it through will be moved to inactive. Those bills are still alive next year, but they are, ready to go. They start where they stopped this year. So if it had already passed the House, it doesn't have to start over again. It'll start up again in the Senate next year. So that's good. I know we are on our last bit, but if we can just go to that hand diagram, I just want to remind everybody that the best time to advocate is literally right now, right? Not 2 days after session, but the summer. That is when legislators are back home. They have more time. You might be able to meet them for an hour for a coffee, or have them invite them out to where you work. You don't have to wait for bring your legislator to work day. You can, or month. You can invite them at any time to come in and meet with you, and talk about your priorities, or talk about importance of employment if you're bringing them to work. They're great opportunities. And if you don't want to do it alone, find some other people in your community that want to meet with their legislator, and everybody go grab a cup of coffee or something, or meet up in a park, on a mall, wherever's convenient and easy for you guys. It's just really important to do it now when legislators are sort of fresh and they have more time. This is when they start thinking about the bills they're going to offer next year. So I would just encourage you not to wait, and to use that hand diagram to show kind of like how you might want to construct what you say to your legislator. Brooke, I'm going to turn it over to you because I just keep rambling here.
Thank you, Amy. That was just so much information. And yes, what Amy said is true. This is the best. I know you hear this from us all the time, but after session during the summer is the best time to develop those relationships, because they are so important. I know Amy just went through a lot of information. I do want to see if anybody real quickly has any questions. You can raise your hand, come off mute. People might just be really tired and glad that session's over. I know Amy is.
Yeah.
Amy, this is Kevin. I've got a quick question for you on the modified tax credit for vehicles.
Oh, yeah.
Yeah. So we just happened to actually purchase a wheelchair van, and we did not pay tax on the modification. So is that more of a credit, like on after the fact when you file taxes?
Yes, it's a tax credit.
Okay.
Yeah.
So it's not necessarily not treating sales tax at purchase. It's a credit down the road.
Yes.
Okay.
So you said that you didn't pay sales tax on it?
Correct.
Okay. Yeah.
You have to have a physician's script in order to do that, justifying it. But yeah.
Okay.
So it's tax credit. Okay.
Yeah.
I mean, it's helpful. Those things are very, very expensive.
Yeah, we thought at first it was making it tax free, and then I think they modified that at some point.
Okay.
And to answer your question, Jenny, yes, work without worry is one that could possibly be ripe for next year. So that would be a good bill to keep talking with your legislators on over the summer. And if there's any resources that the council can help with you and your advocacy as you're doing that, just let us know. We're happy to help. And with that, we're at 12:30, but Emily, can you go to the last slide? We won't be having another regular capital chat until the summer, and we don't have that date set up yet, but it'll probably be towards the end of June. But we do have an opportunity for you guys to participate in our state plan. And so we are hosting a May 30th event through webinar. It'll be a full hour for you to provide some input into our state plan. If you did fill out the survey a couple of months ago, that doesn't mean you cannot participate in this. The questions are going to be the same, but it'll be a chance for you to kind of verbally talk about what you'd like to see in our state plan. And then, I don't know, Amy, if you're still here, Kelly Marie has another question. Is the bill about testifying remotely only if the child person with disabilities is the victim in a case, or if they're also just a witness?
Either.
Either, I
Yeah.
think, yeah.
Anytime they'd have to appear in court, they would have that option. Wouldn't have to if they felt comfortable going into court, they could. But it's meant to limit intimidation. They had a really big burly police officer testify and said somebody had shot him, so he had to go into court to testify, and he said he was shaking and scared testifying in court. He can't imagine a kid.
And then the autism support program, Amy.
They didn't get rid of it.
That's what I thought. Yeah.
But they didn't add any more money for it. I think they've got additional money available to do it. So yeah.
All right. Well, thanks everybody. Hopefully we'll see you at one of our events this summer. If not, enjoy your summer and take care.
Thanks everyone. Bye.